In January 2016, the Ebola virus epidemic was finally declared over, about 2 years after the initial outbreak. Millions of deaths had been predicted. The final death toll was just over 11,000, with more than 17,000 survivors struggling with the medical and social fallout and with the ravaged economies and health systems of their countries. It had been a really devastating crisis, but it could have been much worse. My name is Melissa Leach and I'm Director of the Institute of Development Studies at the University of Sussex. As an anthropologist, I've worked in the Sierra Leone, Liberia, Guinea border region on social, environmental and health issues for nearly 3 decades. In September 2014, I helped bring together a team of anthropologists who shared long-standing interests and commitments in this region and beyond. We had a really strong sense that the unfolding Ebola response, which was faltering, in part for social and cultural reasons, needed input from the social sciences. We established the Ebola Response Anthropology platform, and this became a key resource for anthropological advice and dialogue in the UK and internationally. We delivered real-time input on areas ranging from diagnosing cases, caring for the sick and dealing with death and funerals, to engagement with communities and addressing the social resistance and violence against health workers. As a result of our work, community care centres were developed for initial triage and isolation of cases as a more acceptable and socially sensitive alternative to the very large Ebola treatment units which were arousing so much local anxiety. Agencies prioritised safe burials, but in socially appropriate and more respectful ways that appreciated their significance to communities.
The people closest to the dying person have been very much involved in nursing them. So the possibility is that they are themselves already infected and developing Ebola. But the sympathisers at a funeral are then closely in body contact. Tears are literally mingling. People are changing their practices because they know how dangerous a disease Ebola is. But it's a question of how quickly they can change and in what respects they change. And there are some parts of funerals that are not really negotiable.
Basically the kind of UNICEF form.
We directly informed the social mobilisation efforts of NGOs and the Sierra Leonean government, identifying how communities' own learning and behaviour change were turning the epidemic around and how this could be supported. Our team members joined local researchers, practitioners and community members to conduct on-the-ground fieldwork, providing support for community engagement and delivering training for clinical and humanitarian personnel. We directly shaped the UK's strategy in Sierra Leone, advising the Chief Medical Officer and the government Chief Scientist. Chris Whitty was DFID's chief scientist at the time.
It was clearly a disaster for the countries that were affected, but could easily have rolled out further over West Africa. And without the insights that we got from anthropology and the behaviour change around, in particular burials, but other activities, social activities, that we were able to institute with the community based on these insights, I think that we would have been much, much closer to this spreading even further and claiming many more lives than it did.
A number of the SRC grants and centre support over several decades was really important in building the deep knowledge of social, cultural and health issues in the region that we were able to mobilise so very rapidly when Ebola hit. Our work has attracted huge interest internationally, signalling a step change in recognition of the importance of social and anthropological research in humanitarian action. We're now working with several international agencies to develop our model into broader platforms for preparedness and response, both to epidemics and to other emergencies across the world.